the turning point for what is going to really bring our lives back to normal within the next year or so. So I think it's a day for celebration.
The U.S. is closer than ever to its first dose of a COVID vaccine. An independent panel has endorsed Pfizer's vaccine as the U.S. keeps setting records for deaths and new cases. The FDA is expected to follow that recommendation and approve a vaccine within days.
The first shots may be ready for Americans by next week. Today's meeting took place like so many in 2020, online. Panel voted 17-4 in favor of that vaccine, said it appears safe and effective in people 16 and older. Research shows it's 95% effective. Much of today's discussion was whether to recommend authorizing shots for 16 and 17-year-olds. Some experts worried there's not enough data there. Nine Health expert Dr. Pyle Coley says more studies will be needed to conclusively find any possible adverse side effects.
The caveat to all this is that this is an emergency use authorization, so very close post-marketing surveillance will be necessary because we developed this at warp speed. And so it's not clear right now entirely everything that's going to come out, just as we saw those allergic reactions occur yesterday, for example.
Once approved, the first doses will move from a plant in Michigan to hospitals and distribution centers across the country. The U.S. could become the fourth country to authorize use of that vaccine, behind the UK, Canada, and Bahrain.
Healthcare workers and people living in long-term care facilities will be the first vaccinated. They've been hit hard by this pandemic. Two big name pharmacies have stepped in to help distribute the vaccine to them. But as Allie Levine shows us, it's not going to happen overnight.
Seeing the vaccine on the horizon and now on the near horizon, we have a great deal of hope.
For months now, Dr. Gregory Johnson has waited for a vaccine.
Yeah, wow.
A vaccine that was endorsed today.
My heart kind of leaps at that, and the scientist in me has some reservations.
The Pfizer vaccine is expected to arrive in Colorado as early as Sunday. Dr. Johnson says it'll take some time for residents in long-term care facilities like Good Samaritan to be vaccinated.
There will be a lag. Some of that's about transportation and logistics.
Walgreens and CVS partnered with the CDC to take care of all of that.
It's a great service.
And it's available to more than 15,000 nursing homes nationwide.
They're really hoping to get vaccine in arms by the time the ball drops in Times Square.
They'll visit each facility 3 times.
And that's essentially 45,000 visits. There's a lot of people to vaccinate, but we're excited that it's beginning.
Dr. Johnson still doesn't know when he'll get the first shipment. In Colorado, Good Sam has 338 residents. That would mean 676 doses to vaccinate everyone, but
nobody's mandating the vaccine. I think that we're neither mandating it for employees nor for residents.
He expects that to impact when and how they can reopen facilities to loved ones. In the meantime, he asks everyone for patience and to not give up hope.
It was so hard to hope against hope that we were, just going to wait until this whole thing ran its course, and that isn't the case anymore.
Allie Levine, 9 News.
Walgreens will handle administering the vaccine to Good Samaritan facilities in Colorado. They're expecting to use both the Pfizer and Moderna vaccines once approved.
The vaccine news came the day after the U.S. set a new record with 3,100 deaths in a day. And November 27th is now Colorado's deadliest single day of the pandemic, with 59 deaths reported. We're averaging about 47 deaths a day. If you look back toward the start of the month, you can ignore the drop off on the right side of the graph because the deaths come in reported days or weeks later, so those numbers backfill over time. We're seeing some other encouraging signs. Hospitalizations from COVID are down. 1,545 people have confirmed cases in Colorado's hospitals. That is down 300 patients from the peak last week.
9.6% of tests were positive yesterday. We're averaging a little more than 11% over this last week. The state added 3,900 new cases yesterday. It's still a lot, but our 7-day average is dropping to about 4,000. That number was 5,000 3 weeks ago. While numbers are going down, that doesn't necessarily mean we avoided a spike in cases from Thanksgiving. Nine Health expert Dr. Pyle Coley says it may be too soon to tell.
I really think there's a lot of under detection going on. And the data is telling us that, there's 4 to 7 times as many cases out there as we're documenting. And I think Colorado is victim to this because we're not really testing enough.
Dr. Coley says the benchmark is testing 2% of the population each day, which is about 100,000 tests. Most days we're well below half that. Dr. Coley and health experts hope people stay home for the upcoming holidays so we don't see an even bigger spike later this month or early next.
Hopeful that people do follow the rules, because if Thanksgiving was a precedent, then I'm going to get nervous that Christmas, Hanukkah, New Year's are just going to layer on more and more and more on top of each other. And as Dr. Fauci says, this is one disaster after another.
If you are choosing to spend time with people outside your bubble for Christmas, Dr. Coley says to start quarantining now. 2 weeks of quarantine should help limit the risk of exposure.